I think it's a bad idea for several reasons. One is that if you postpone certain shots in order to space them apart so that you're not giving several injections on one day, then the baby might actually get the infection before they have immunity. The other is that by giving the injections on multiple days instead of all at once, you're actually subjecting the baby to more stress.
So all vaccines that are licensed in the US go through very rigorous clinical trials looking at both safety and effectiveness before they're licensed by the FDA. Once they're licensed, we also have many surveillance systems in place to monitor the safety of these vaccines. So pharmaceutical companies do support the research that occurs prior to a product becoming licensed, and that's part of their research and development. But all of the research that we do looking at vaccine safety and effectiveness, so how well these vaccines are working, are really entirely funded by the American taxpayer. So we're not supported by pharmaceutical companies, and we're very careful to make sure that we do not appear or have any conflict with vaccine companies when we're doing these studies and evaluations on vaccine safety and how well these vaccines are working.
Thimerosal used to be placed in vaccines as a preservative in order to prevent bacteria from contaminating these vaccines. Thimerosal was removed from most vaccines in 1999. And so it's really not much of an issue anymore. But even before that, it was never shown to actually cause any brain problems. That was the theory, that it was toxic to the brain and that therefore maybe it was also contributing to autism. Since removing thimerosal from the childhood vaccines, the autism rates have gone up. Aluminum is sometimes placed in certain vaccines to help boost the immune system response to the vaccine. And not all vaccines contain it, and the ones that do contain a very small amount. But aluminum is also present in the water we drink, it's present in foods that we eat, it's even present in breast milk and baby formula. The reason we give so many vaccines is because we're trying to prevent the problems caused by these vaccine-preventable diseases. When we don't immunize a child, that's what we're doing. We're rolling the dice and hoping that they don't suffer from one of these vaccine-preventable diseases. So with the progression of science and the observation that with the decrease in incidence of some of the diseases for which we vaccinate, there are other diseases that come to the forefront that are causing most of the serious diseases in children.
I'm not sure why people are distrustful, but I think parents should trust us because I think maybe there's this disconnect in that, we're doctors and nurses and public health people who really strongly want what's best for the public and for people's health, and that's why we're in this business, is we're passionate about the work that we do, but we're also parents and grandparents and friends, and we wouldn't be vaccinating our kids if we didn't believe very strongly in the safety evidence behind these vaccines.